Welcome back to another video. A cause for concern amongst new mothers is the shape of the newborn's abdomen. The abdomen in a newborn appears full, rounded, and protruded. And mothers worry that when the child grows up, the child is going to have a protruded belly. The shape of the abdomen in a small baby is only temporary, and it gets better as the baby grows. It is mainly because of the lax muscles. So when the baby lies flat, the abdominal viscera, they tend to sink down into the abdomen and gives a full and a rounded appearance. And also, when newborns are fed, they tend to swallow a lot of air along with the milk feed. And that also gives rise to the bulge of the tummy. And as I said, this is only temporary, and the shape is going to get better with time. The umbilical cord, which attaches the baby to the placenta, is usually clamped and cut off right after birth. The cord has 3 vessels, 2 arteries, and 1 vein, enclosed in a jelly-like substance which may appear to be coiled and twisted. Now, after the cord has been clamped and cut, it usually falls off between 10 days to 3 weeks. So it can take as long as 3 weeks to fall off too. And it goes through a normal process of color change. From the jelly-like whitish appearance, it becomes yellow, turns into brown, shrivels, becomes black, and then falls off. My advice is don't submerge the drying umbilical cord in the water while you're bathing the baby. Keep it nice and clean and dry. Use alcohol swabs. Every time you change the diaper, take the alcohol swab and clean the umbilical stump. Don't be scared to clean it nicely. It does not pain. The baby may cry because the alcohol swab, feels cold on the skin, surrounding skin. So that's fine, but you must clean it nicely, otherwise there is a chance that it can get infected. If it turns red, if there's a discharge, if there's a foul smell, that's an indication of an infection, and you must take your baby to the doctor. Now, usually once the cord falls off, there may be a slight discharge from this stump, a slight blood-stained discharge. Again, that's normal, nothing to worry. Keep it nice, clean and dry, and this will heal over the next few days. In rare cases, once the cord falls off and it is not detached cleanly, there may be a yellow sticky stump which keeps discharging, doesn't dry up. Now, if that happens, then you will need to go to the doctor, because the doctors will usually cauterize the stump with a silver nitrate stick and just burn that area to dry it up. Now, because it's done with silver nitrate, the surrounding area around the stump can turn black for the next few days. Once it's been cauterized, keep it nice and dry. Don't wet it. In a few days' time, it will just heal. Umbilical hernias is again a fairly common thing that we see in babies. It is usually a weakness in the abdominal wall and a lax ring, the umbilical ring. And through that ring, through that weakness, the intestine tends to come out, push out. Now, a lot of mothers think that it pains, it causes a lot of discomfort. No, it is painless. It does not cause any discomfort. When you press on the hernia, you will often find the gurgling sound of the gas in the intestine and as it reduces. When the baby cries or the baby is very active, it tends to become more. Now, a number of times I have seen young mothers use different kinds of techniques to try and reduce the hernia. They strap coins, they tie the abdomen very tight. Now, none of this helps because this is going to close on its own as the baby grows up. And it can take anything up to a year for this ring to close. Once it closes, the hernia disappears. Strapping, putting coins, putting tapes is a source of discomfort and can also give rise to skin infections in that area. So this was about the abdomen. I shall see you in the next video soon. Till then, take care of yourselves. Thank you.